Now, in terms of evaluating next steps and looking at the market in terms of what we're doing, of course, we have to deal with physicians and patients, but also with providers and payers, and we've got to look at the market scenario. We've done a couple of important things. First of all, we've engaged a panel called Excite in Canada, which is an excellent panel put together with practicing physicians, surgical oncologists, as well as representatives from payer organizations. And they've vetted what we're doing extensively. We've had a number of meetings with them and very valuable feedback from them with important advice on positioning our technology the right way. And in fact, their feedback is one of the things that alerted us to the potential of using skin cancer, melanoma, as a good first in human indication. Could we go back to colorectal in the future? Of course, that's possible. But as first in human, melanoma is an excellent choice. And the second thing we've done is we've already started working with the FDA. We've had our first pre-submission meeting with the FDA. Now, when you go through a regulatory process, you have to submit a package. In our case, it's called an IDE, an investigational device exemption. And before you submit that package, you have what's called a pre-IDE meeting. We've had our first one now, and very valuable feedback there from the FDA. A large panel of people from the FDA responded to a number of our questions to them, and we now have minutes recorded from that meeting. And so good feedback on moving forward.
Thanks, Len. And the one thing I would point out here with both of these entities, the reason we put this in here is that our development plan has effectively been developed with feedback and input from both of these entities. And Len pointed out that with payers are a significant constituency. We were fortunate to have on our panel there are 4 payer organizations. One of those individuals who represented one of the largest payers in the US has asked to join us at our next pre-IDE submission meeting with the FDA sitting on our side of the table. It's really valuable, as we, I think, perhaps mentioned previously, but the folks from the NCL attended with us, had offered proactively based after they've analyzed our materials and sat with us on the other side of the table in our first meeting. This is why we're really feeling strong, and this is why you're seeing some shifts and pivots as we focus in, and even as Carmen talked about the specific focus being late stage, stage 3 and stage 4 for melanoma. It's been due to the input of these folks, which we're extremely fortunate to have. So